Over the last 20 years, we've seen centralisation of particular services to specialist units and hospitals. And if we take a group of conditions, the evidence is really clear that the chances of you surviving your illness and also leaving hospital less disabled is crystal clear. So myocardial infarction, heart attacks is a good example where 20 years ago people who'd suffered a heart attack would go to their local general hospital. What we've learned over the last 20 years is that, first of all, breaking down the clot with drugs and now breaking down the clot with wires and stents gives you a better outcome, a better chance of survival and a better chance of less heart failure. These centres can only be in certain areas where you have a specialist workforce, where it's manned 24 hours a day, 7 days a week. So for heart attacks, the evidence is crystal clear. You're more likely to survive if you go to a specialist hospital. The same is true for vascular surgery, so both surgery on the arteries in your neck, but also within your abdominal aortic area. The evidence is very clear that you're less likely to have complications and die if you go to a specialist centre which does lots of these operations. So it's about the healthcare team who are performing the procedure, doing lots of them, so they're experienced and they see the wide variety of complexities within that condition. We have it the same for paediatric oncology and neurosurgery. We already centralise those services. What we've learned is there's lots of other specialist diseases that actually aren't that specialist, they're quite common, but need to be cared for by specialist individuals. Stroke disease, which of course is my great interest, has got a very firm evidence basis, which over the last 20 years we've known, if you get to a stroke service that is a stroke unit which is manned by therapists, nurses, doctors, 7 days a week, the chances of survival and the chance of getting home, of having a functionally normal life, are much higher than if you go to a general hospital. So specialisation for certain conditions is without doubt best for patient outcomes.